I'm going to move into routes of administration. So the first route I'll talk about is sublingual, and this is a medication that's given under the tongue. Turns out that the area under the tongue is very vascular. And it lets the medication get directly into the bloodstream without first going to the liver. This is an interesting facet of oral medications, is that the blood vessels that come from the stomach and the gut, they're directed straight to the liver. So circulation goes to liver. So when you swallow a pill, so imagine you take an Advil or a Motrin for some muscle pain that you have. You take it, it goes into your stomach, so you take it via the oral route. You swallow it, it goes into your stomach, and it's actually absorbed into the bloodstream. And it's absorbed through the stomach and intestinal tract into the bloodstream. From there, all of that blood will go to the liver. And the liver's job is actually to break things down. So it breaks down some drugs. And it turns out that nitroglycerin is one of the drugs that the liver breaks down very, very quickly. Generally speaking, by about the first time that nitroglycerin has made it to the liver, it's almost completely broken down. Now, the liver can't catch all of the little nitroglycerin molecules at the first chance, but in about 3 to 5 minutes, almost all of that nitroglycerin is going to be gone from the body because the liver is going to break it down into something else. So the reason that we give nitroglycerin under the tongue is that it doesn't immediately go to the liver. So it'll actually get to the heart and the other peripheral vessels before it gets broken down. So that's the reason that we may pick sublingual and not oral as a route of administration. The process I just described, where medications first go to the liver, it's called the first pass effect. So if you're interested in learning more about that, you can look up the first pass effect and it'll tell you about it. But the first pass effect is the reason that nitroglycerin is given sublingually. Another route of administration is inhalation, and this is where a gas or an aerosol is inhaled by the patient. For example, oxygen by mask, albuterol by handheld metered dose inhaler like this kid, or by small volume nebulizer. And we'll talk about both of these and learn how to use both of these in class. The next route is injection. And in an injection, the drug is injected into a muscle mass, or in this case, I don't really know what that is. That may be a different kind of drug. But all the drugs that we use at the EMT level that are injected into a muscle mass. So epinephrine by auto-injector. And we will learn about this and get some practice with some practice modules without any needles. Another form is a tablet. And this is a compressed powder that's shaped into a disc. So you can see the tablets here. And the two drugs that you need to know for this are aspirin and nitroglycerin. Another form could be a liquid for injections. And this is a liquid with no particulate matter, like epinephrine. Epinephrine is a liquid with no particulate matter, and it's injected. The next substance is a gel. And this is a viscous substance that the patient swallows. And our example for this is oral glucose. So this is a tube, and inside this tube is a gel that has sugar in it. The next one is a suspension. The example we have here is activated charcoal, and this is activated charcoal right here. And a suspension is a drug particle, or it's got drug particles mixed in a solvent. So in this case, you basically have little pieces of charcoal that are suspended in water. And the charcoal just kind of floats there, just kind of hangs out. There's enough charcoal in here that they kind of, pack up on top of each other, but you have to shake it up. See how it says here, shake well before using? That's because it's a suspension. And suspensions, you always want to shake well before use. The next one is a fine powder for inhalation. And this is a crystalline solid that's mixed with a small amount of liquid to form a suspension. And the example we have here is Albuterol by handheld metered dose inhaler. Next medication is a gas. The only gas that we carry is oxygen by mask. There are a couple other medical gases, most notably nitrous oxide, which is NO, and that's laughing gas. Nitrous oxide, laughing gas. Some of you may have had it at the dentist. I did when I was younger and had to get, laughing gas. Start talking about the dentist. I had a tooth pulled when I was young and they gave me laughing gas, so I remember that. Sometimes laughing gas is actually used on the ambulance because it's a very potent painkiller. The problem is it only works for as long as you're breathing it. So in order to continue to get the pain relief from laughing gas, you have to keep breathing it, and a lot of hospitals don't use laughing gas. So it works great for patients on the ambulance, but then you have to transition care, and then they'll go for probably almost an hour without getting any medication for pain. So it's not too common, but it is out there. The next form is a spray, like a nitroglycerin sublingual spray. And under this cap here, there's just a little pump top, and you push it down, and then it sprays out. The next form is a vaporized liquid, so this would be Albuterol by small volume nebulizer. What happens here is that you've got a little cup. You can see he's holding kind of this cup thing here, and the oxygen tubing is coming up here, so the oxygen's coming up here. You put the liquid in, the oxygen bubbles through it, and what happens is the oxygen bubbles through it is it comes out here at the top, and it brings some little particles of this albuterol liquid up with it. And so you actually breathe in these little particles through this little pipe. So the particles go in that way. And then they get into the lungs and they do their job.